Good morning. My name is Joe Doherty. I'm a liaison with the Unified Command Group, part of the COVID-19 response. I'm here to start a press conference for Thursday, July 16th, 2020. We will start today with Dr. Angela Dunn, State Epidemiologist for the Utah Department of Health, and she'll be followed by Governor Gov Herbert, who will introduce a couple of our other speakers today, including Dr. Tom Miller, the Chief Medical Officer for University of Utah Health, and Lexi Cunningham, the Director of the Utah State Superintendents Association. Dr. Dunn.
Okay, good morning. All right, so today you're going to notice on the updated dashboard that we have new features and analyses. In the email that we send to media, with the case counts, there is a link to the YouTube video that will explain all of these new features. There's also a link to this video on the coronavirus.utah.gov homepage above the case counts button. So today we are reporting 31,845 cases. So I need to provide a lot of context to these numbers because today we're adding cases that have been identified over the past 6 weeks, but we are just now including them in our case counts today. So 251 of the new cases are from antigen tests that some labs started reporting in June. We at the Department of Health have been reviewing the antigen test results for accuracy and completeness, and will now be adding positive antigen tests to our total case counts every day moving forward. Antigen tests, like PCR tests, detect active infection of COVID-19. Additionally, due to a delay in electronic reporting, 50 cases that were added today were diagnosed in the first week of July, and 246 of the new cases today were diagnosed earlier this week. Both the delay and the antigen test are added to the case counts today. Both the antigen tests and the backlog results have been added to the charts on the trends page, and they're added by the date they were actually diagnosed. So these charts present the most accurate picture of the current status of the COVID-19 outbreak here in Utah. Our 7-day rolling average of new cases is 619 cases per day, and our 7-day average positivity rate is 10.4%. And now I'll turn the time over to Governor Herbert. Thank you.
Well, good morning, everyone. Thank you very much for being here. Thank you, Dr. Dunn, for your work as part of our team. I know testing has been a challenge since the beginning. I've talked with a number of the governors just this morning, and Governor Abbott from Texas, for example, and testing has been a challenge everywhere. We're making renewed efforts to make sure that tests are available to everybody and increase the volume of testing that's being done, and to shorten the time delay to get our results back. That will help us with our tracking and tracing. Contact people who've got it to make sure we have isolation and the ability for us to help slow the spread. And testing is really something we're going to emphasize in a greater detail over the next few days. With that, let me also thank, we had a press conference yesterday that was done in Spanish for our Hispanic population, in particular those that are here. We have about 13% of our population is Latino Hispanic. And I appreciate the fact that we had an opportunity to address those who actually have a higher incident of COVID-19 than their numbers would warrant in the population. And again, information given to them will help them have best practices to help them do what needs to be done to slow the spread inside their own community. And again, we also shared information that helps them with unemployment insurance and access to job training to help them get jobs if they're out of work. and rental assistance, as well as the business resources that are available from the Suazo Business Center. I want to thank Consul General Berhone, who was there to help us with those efforts yesterday, and we thank everybody involved in that press conference of yesterday. Let me just say, as part of my remarks here today, that I appreciate the work of many people in our state in these very difficult and uncertain times. I know there's a lot of anxiety out there. People are wondering what tomorrow will bring. How are we going to survive the economy? How are we going to open up our schools? Am I going to catch the COVID-19 virus? Are my children going to be influenced by the vaccine and what they're able to do or not do in their lives? We have a lot of challenges out there, but I appreciate the fact that many people are rolling up their sleeves and rather than just wringing their hands saying, let me see what I can do, and making an effort, in fact, to stay home if they're sick. I know that seems like such a simple thing, but we tend to be people who want to work and engage, but we have to change our habits a bit, and if we're not feeling well, to stay home, and employers should, in fact, encourage us to stay home if we are, in fact, sick. It's important that we maintain our physical distancing of 6 feet. Again, it's becoming part of the lexicon. Social distancing means something, of staying 6 feet apart from each other. And certainly wearing our face covering masks to help us. We'll talk more about that here a little bit later, but we know that these behaviors and these changing of habits by people will in fact help us address the challenge of the spread of this COVID-19 virus. And there's a lot of voices that are uniting in that effort out there as we coalesce and come together. The Utah Medical Association, our healthcare experts throughout the state, virtually unanimous in giving us instruction and telling us what we should be doing as individuals and families to slow the spread of this virus. Utah Hospital Association, most all of our faith-based organizations, including the LDS Church, and certainly our business community, all uniting, saying we need to watch what we're doing and make sure that our behavior is what we need to have to slow the spread of this coronavirus. I appreciate the Salt Lake Chamber of Commerce leading out with other businesses and encouraging safe operations of their business, meaning that they want to make sure that their employees are in a safe environment, that they're being screened when they come to work, that they are in fact using face coverings when they cannot social distance. I believe they're doing this to engender consumer confidence. The economy will continue to open and blossom if our consumers feel comfortable and confident that they're going to be going to a safe environment, not only to work, but to shop, whether that be restaurants or retail outlets. And I appreciate that the Chamber is leading the effort to have our businesses make sure that consumer confidence is coming back. They have a program called Take the Pledge, where they're asking businesses to take the pledge of what they're going to be doing to, in fact, make sure they have a safe environment to work and a safe environment for consumers to shop. I'm encouraged by such names as Walmart, Harmon's, Kohl's, Smith's, some of our local-based grocery stores and retailers requiring patrons to wear masks when they come to their shop of operation, which makes it safer for them and safe for those others who are shopping. It shows respect for your neighbor. And more people are taking the precautions necessary. And so I thank you all for your efforts. Although they may seem small, collectively, all of us working together makes a big difference. And so thank you for caring about others in your efforts and in your conduct. The fact that people are doing this really on a mostly voluntary basis is encouraging. I'm confident the state statute, our Constitution, allows me and our state health department, in fact, to make these things mandatory. I much prefer us doing it on a voluntary basis, not because government is compelling you to do it, but do it because you have respect and love for your neighbor. You show that by wearing your face coverings when you cannot social distance, for example. Again, doing it for the right reasons is the right way to do it. So we encourage everybody, in fact, to take that extra effort to say, I'm going to do it out of regard and respect for those that I associate with, my neighbors. It makes us all feel more comfortable as we're around each other. I know that none of us would not want to knowingly spread the COVID-19 virus to others. So we taking those precautions will at least give us some confidence that we're at least minimizing that risk to others. We will continue to adhere to local control as we've set up the policy heretofore. Currently, as you know, counties can request tighter restrictions, working with their local health departments, looking at the data that informs us as far as what to do and what the condition of their local communities are in, and work with our state health department. We have Salt Lake County, Summit County, Grand County that have in fact received those approvals to have a mandate for mask wearing in their local communities. And we're starting to see some positive results for that effort. So we're seeing certainly better compliance with face mask wearing and when you cannot socially distance. And I think more compliance is going to happen in Summit and Grand counties. And hopefully the end result is going to be that we're going to have a lower incidence of infection. Slowing and stopping the spread is our goal. Everybody wants to see that happen. This is a step we can take that we learn from our healthcare experts who tell us that's in fact what we ought to be doing if we really want to do the best effort to slow the spread of the coronavirus, wearing of the mask. Now, I know that's not without controversy out there. Certainly the fact that it's being mandated is somewhat controversial for some who say, you shouldn't tell me what to do, and we would encourage you to do the right thing so we don't have to tell you what to do. That would be the way we'd like to see it. We also hear from people who insist that mask wearing will cause harm. Breathing your own carbon dioxide, for example, for an extended period of time will in fact cause your own health to be impacted in a negative way. So to address that very issue, we've asked Dr. Tom Miller, who's the Chief Medical Officer for the University of Utah Health, to address the science behind the wearing of the mask and face covering. So Dr. Miller, would you come forward, please?
As I take my mask off to speak to all of you, citizens of Utah, I'm pleading with you to put your mask on. And put it on now. Let's not put it on next week or next month. Let's do it now. These are great words from Governor Herbert about being responsible to each other. No one likes to have a mandate, but we all need to group together and link arms so that we can protect the citizens of the state of Utah. Why wear a mask? For 140 years, we've known that masks have prevented the spread of disease, and that's why surgeons wear them. You would not likely go to see a surgeon for an operation without them wearing a mask. So we know that they work. Masks are uncomfortable when we first put them on. Masks are hard to find sometimes. It's hard to remember to put them on. And we don't have to put them on forever. My plea to all of you is to put them on now, and let's keep them on while we have this surge that Dr. Dunn was telling us about a minute ago. Our hospitals are near capacity. We want to be able to take care of all the patients that need our care without overrunning our beds and our nurses and our physicians. So if we all link arms and we all work together, we will get through this. We will slow the spread. So masks are our medicine right now until we have an effective treatment or a vaccine. Think of it that way. Let's be mask missionaries. Let's get these masks on. And as we wear our masks in public and keep distance and wash our hands, let's not shame or blame. Let's use our mask wearing as a message to the rest of the public that we are serious about protecting those that we love, our family, our parents, our grandparents, our coworkers, and those who are most vulnerable. We will get through this, but we need your help. So put your masks on. Let's get through this, and then you can take those masks off. Thanks.
Thank you, Dr. Miller. Again, I know it's somewhat of an inconvenience and a sacrifice to do this, but let's as a state work together and rise to the occasion. The sooner we get this coronavirus turned around, the sooner we can get back to more normal activities and discard the mask. But it's going to take us some time to get through that. If we all work together, we can get through this sooner rather than later and save people's lives and the inconvenience of being sick and having the virus until we can get a vaccine, which I hope is on the horizon here sometime this next year, which will help us, in fact, address the issue in a better way. We're just kind of treading water. How can we get through this right now until we, in fact, get this turned around? And clearly our efforts, as you've heard from Dr. Miller, we do not want to overwhelm the medical system itself, the hospital beds, et cetera. And we're going to work very hard to make sure we keep those numbers of cases down. I set a goal for us last week to see if we could have the rolling average to be less than 500 cases. And I think we can do that. We've had some ups and downs here with the new accounting system that we have here and new information that's coming on some of these other tests. But the challenge of having a 7-day rolling average of below 500 cases still stand. I think we have signs that it is doable. And despite the higher numbers that have been reported today, I believe it is doable. But it's going to take all of us working together in a concentrated effort, all of us doing our part. So my plea is for all of us, do what you can and do your part, and we'll get through this. The next issue I'd like to talk about is something that I know is on everybody's mind, and that's about schools. And we're getting through the summer here, and we're going to have school opening here in the next 4 or 5 weeks in most every part of our state. And I've announced an order that came from our state health department to, in fact, require mask wearing, require students, our teachers, our staff, visitors to our public education systems, our charter schools, and our private schools to, in fact, wear a mask. The purpose of that is to create the most safe environment possible for those involved in our public education system. Nobody wants anything other than a safe environment for our young people, our students, to go be taught. We also recognize that some of those who may be most vulnerable in our school system are the teachers, the principals, the staff members there, janitors, bus drivers, those that are involved in our school system. We want the safest environment possible for them. It's imperative, I think, that we open our schools. We cannot afford to have schools closed. This generation needs to have education and training and skill development, hopefully to get them on to higher education opportunities. And so I think it's imperative we open our schools, and our schools, our school districts, we have 41 of them, need to have their plans in place by August the 1st. I should take time here to say, I hope everybody appreciates the hard work of our superintendents, our school board members, our principals, our teachers, as they wrestle with this very difficult and very emotional issue by people as far as what do we do to open up our schools. This is not an easy thing. It's certainly not black and white. It certainly has a lot of moving parts and a lot of uncertainty and speculation. And that causes fear, and people get a little bit angry sometimes when they're afraid. So show a little grace, all of us, to those who have to make the tough decisions about how we go about opening up our school systems. Again, our superintendents, our school board members, our principals, and our teachers, members of the faculty are doing the best they can to make sure you can feel confident in your school opportunities. There's going to be some, this public health order that's been issued is going to have some variations from what we've talked about here last week, some exceptions to a blanket mandate. Let me just mention some. If you're maintaining your physical distance of 6 feet or more, you won't have to wear a mask. If you're eating lunch, obviously it makes it difficult for you to wear a mask, and certainly we'd encourage you to have social distancing even while you're eating lunch. We're making some common sense exceptions, I would call them. Children that are younger of age, again, across the state, younger than 3. But in schools, those involved in kindergarten, the younger grades, there may be some needs to, in fact, allow some differences there on mask wearing. Certainly common sense for those who have disabilities that may make it awkward or difficult for them to wear a mask. Deaf, hard of hearing examples. Again, we would encourage our teachers to wear clear face shields because the students need to see their facial expressions. Again, if you're deaf, be able to read lips, those kinds of things. Again, common sense variances and exceptions to the rule. The full order, once it's finalized, will be posted at coronavirus.utah.gov, our webpage, coronavirus.utah.gov. And so you can read the details, and that doesn't mean we can't make some modifications, improvements if we get down the road and see some need. There's also going to be a section there on extracurricular activities. Again, whether that be our sports, it could be our music, drama, the chess club, a lot of different activities that are involved. Those are being worked on and reviewed as we speak, and they will be made available tomorrow by 5 o'clock. I'm also announcing today a change in our color-coded guidelines. As you all know, right now the state of Utah is virtually all in green, mostly in yellow. The exception to that is in Salt Lake City, which is in orange. We're going to make a modification to the orange guidelines to accommodate Salt Lake City School District and those schools which are found inside the Salt Lake City limits, so that they also can open up and have every opportunity that the other districts and other schools in Salt Lake County have by virtue of being in yellow. So that modification will in fact allow them, and hopefully our capital city, we would hope over the next few days, few weeks, we'll be able to move from orange to yellow. That's certainly the goal. I've talked with Mayor Mendenhall, and that's her goal too. We hope that that happens, but in the meantime, we want to make sure that the schools are going to be able to open up. So until it goes to yellow, the city, we will have a modification in orange to accommodate Salt Lake City. This will allow them to open up. They will work with their school boards as they prepare their own plan that has to be in by August the 1st. And we expect that they'll be able to function in exactly the same way that any other school in Salt Lake County can do so. Now, we feel comfortable about this. Salt Lake County does have a mandate to use masks, so that gives them a little bit of a leg up, I think. Again, in minimizing the risk is opening up their schools, even though they're in code orange. I want to emphasize, though, that throughout the state, we are trying to provide not only a good school environment as we open up schools and ready for the school calendar year coming up here shortly, but to give parents the option and choices to be made. For example, traditional in-person instruction, we believe will happen, and probably most people will take advantage of that as they've done traditionally year to year. But we also know that there's some that don't want to, don't feel like it's safe. If that's their motivation, whatever their purpose and motivation may be, but wants to do some distance learning as opposed to in-person instruction. So distance learning, online schooling will be made available for those who want to participate in that. And clearly we have a number already of do homeschooling, and maybe more will want to try that as an option. But the intent is to give our parents and our students choices as far as what they have available, but to make sure that everybody has access to a good education this coming school year. We're doing some, I think, innovative things by, we know that necessity is the mother of invention. And certainly with this unique situation we find ourselves in, schools are finding new ways, in fact, to provide learning experiences that are acceptable and profitable for our students as they learn and prepare for life. And some great things are happening in some of our districts around the state. They are innovating, they're planning wisely, and really helping to get ready for in-person instruction. So along that vein, I'd like to welcome Lexi Cunningham to the podium. She is the director of the Utah State Superintendents Association, to share with us some of the examples that are taking place and what's happening here throughout the state as districts prepare to reopen for the school year. So Lexi.
Governor Herbert, thank you for caring about the students and the educators in Utah and prioritizing safety next year for all of our schools. Since the spring, when we went on soft closure, our schools and districts have been reviewing the work that took place in the spring, looking at what worked and possibly what could be tweaked so that they could do better. Many districts and many schools have held focus groups and have surveyed parents, teachers, and students to get their input on their learning options during the school dismissals. We are thankful that the Utah State Board of Education has published a set of requirements and recommendations on opening schools this fall. They've given us the what on what needs to be done in our schools. Districts and schools are now working on the how. How will we address the recommendations? How will we address the requirements? These plans are being worked on, and as Governor Herbert said, are due to USBE by August 1st. Every plan in the state of Utah will address 7 principles: movement, duration, proximity, group size, respiratory output, touch, and congestion. These 7 points, these 7 principles are key to all of the plans in the state of Utah. Every district and every school is different on how they have addressed building their plan and who they have involved. District leaders and our local school boards are working hard to address the needs for their schools and their districts. I have been impressed with the attention to detail of each plan, the focus on student and staff safety, a renewed commitment to cleaning our schools and our buildings, an awareness of the social and emotional needs of all of our students and of our teachers, and a desire to address the academic needs of all students. Every plan is different, as is every district. I'll share a couple of examples of what I have seen. One district for hygiene is focusing on what they call the Big 5: hygiene etiquette, stay at home if you're sick, cloth face masks, physical distancing, cleaning and disinfecting. Another district is maximizing safety, optimizing learning, and supporting student well-being. It is enlightening and refreshing to see districts and our local health departments working together to ensure that our schools are safe. I recently saw a COVID-19 screening flow chart that a district and local health department worked on, and it was very clear the steps that the school and the health department would take if a student or a staff member were to become sick. Choice. Choice is important to our schools, to our districts, to our families, to our students. Districts and schools are providing choice for families and for students. That choice could be all in-person instruction if it's feasible. It could also be online, all online instruction if that's feasible. Some districts are looking at blended models where students may be in school part of the time, they may be at home part of the time online. Other districts are looking at shortening the school day to provide teachers opportunity and time to work together and plan so they can deliver comprehensive online instruction. Districts are also providing choice to their educators and to their teachers to see what is going to best meet their needs. I've been so impressed that our districts are also thinking about our families and they're thinking about our parents. I recently visited a district that is creating a parent handbook to help parents navigate the various decisions that they're going to have to make in the coming weeks and to prepare them to better support their students, whether they're in an online learning environment, an in-person learning environment, or a blended or hybrid learning environment. Input. Many districts have, as I've said, done multiple surveys. They have included parents, teachers, and in some cases students on their task force or their planning teams. One district has hosted 13 focus groups to gather input on what their plan should look like for the coming year. Surveys have started in the spring and they are continuing even now, and many districts are publishing the results of those surveys so that families and community members can see what other people are saying and what the desire is of the district and the community. Schools are working with small groups of students right now to address learning gaps that have occurred since the dismissal in the spring. And they're also bringing in small groups of students to prepare them for the upcoming school year. Every district in the state is concerned about the social and emotional well-being of our students, and they are putting these sort of things into their plans. I recently visited another district that they're going to spend an entire day when their teachers come back pre-service time in helping teachers embed social emotional activities into the classroom so that they can support their students. And in doing so, it is also supporting the teachers. The well-being of our students and the well-being of our teachers is critical to every district in the state. Schools who are geographically close together in the state have also been working together. If there's a great idea in one district, they're sharing it with another district so that we are all collaborating together. An example of that, of the collaboration and the great ideas, is we have a school district in southern Utah that is going to delay the start of their school year to support Utah Moonshot 55, to allow time for staff to plan and more time for the COVID cases in that area to diminish. There are so many wonderful things going on in our state, and our schools and our district and our leaders are working hard to ensure that our schools have plans that are there to support students. I know that these plans are a priority for every district and every school throughout the state. I know that leaders, from superintendents to school board members to administrators, have been engaged in this work since this spring. I know that they are soliciting feedback from stakeholders. Student and staff priority student and staff safety is a priority for all of our districts. Every plan is different, and every plan reflects the needs of the community that it serves. Our districts also know that in this they have to be nimble, that things could change as they did in the spring. I have seen more collaboration, more communication, and a greater commitment to students and staff in the last 5 months than I have seen in almost 30 years of education. I am very proud of the work that our Utah educational leaders and our school board members are doing to serve our students and our families. And I know that when you see these plans, you will be assured that your students will be safe. Thank you.
Thank you, Lexi, and let me just reiterate too that the hard work of our superintendents, our principals, our school board members, and teachers really trying to find the right way to do things. We all want the right outcome, and we differ sometimes on process, but they're doing the best they can. I ought to mention too, by the way, that masks will be provided for all of our students. They come in a variety of colors. I'm wearing one here, but masks will be provided to all the students so that they will have access to face coverings when they come to school. Let me conclude here, and then we'll open up some time for questions. But I do believe we can turn the tide. It's not easy. This is a unique situation. It's an invisible enemy out there, and you don't know whether you've got it or do have it. And the viral load appears to be just as potent before you're symptomatic, and that's a cause of concern. That's, again, why wearing a mask helps us. When you don't think you're sick, you might be sick and spread the virus to somebody else. I appreciate the fact that we are coming together in a united effort. Not everybody, but we're certainly getting consensus out there as far as what we should do, and pulling together is an important part of that. I do appreciate the fact that 28 of our state's faith leaders have sent a letter here this past month to appeal to the people of faith of not only their own congregations, but those throughout the state of Utah, and those who have no faith, but at least they're lending their voice to say to us to wear a mask if you don't social distance, practice social distancing at other times, and recognize there is some sacrifice involved in making sure we wash our hands more often than maybe we've done in the past, have appropriate hygiene. But social distancing, wear the mask, and washing your hands is really an important part of our lifestyle anymore. And if we do that, we're going to be able to save lives. And they say giving up a small measure of comfort is the least we can do to sacrifice to help us slow down this spread of the coronavirus and to save lives. Let me just quote from the letter. It says, quote, "We recall that the greatest commandment is to love God, and the second is like unto it, to love one's neighbor as oneself. One cannot claim to love one's neighbor while deliberately putting them at risk. I think it's pretty concise and direct to the point. So I thank the faith leaders for lending their voices, along with the medical experts, the scientists we have. We're trying to get the best information possible to make sure we give the best information as state government to you, the people of Utah. I appreciate the business community stepping up of their own volition and saying, we're going to do these things. I appreciate the Salt Lake Chamber of Commerce and their Take the Pledge efforts to stay safe, to stay open. We stay safe, we stay open. The economy will continue to grow and open up. We have 1,100 businesses now that have signed the pledge to stay safe, to stay open, and pledging that they will, in fact, make sure that their conduct complies with the good hygiene, safe environment for their employees, wearing of the mask, et cetera, so that we can shop with confidence at their establishments and show by example what the rest of us ought to be doing also. If you want to search for your favorite businesses, you can go to Stay Open Utah, stayopenutah.com, stayopenutah.com, and you can see those who've already signed up. And you ought to, in fact, give them a big thank you by shopping at their stores. We encourage other businesses to sign up too at this website and take the pledge and help our people feel confident when they're out and about shopping, when they enter your stores. This is a safe place to be involved. I'm very confident, I'm very optimistic. Let's all do our part. This will only succeed as we work together. And what comes to mind is the famous phrase, united we stand, divided we fall. I'll modify it by saying united we succeed and divided we fail. It really is up to all of us to come together, to pull together and do our part if we're going to succeed. I believe we can, and I believe we will. So thank you for what you're doing. With that, we'll turn some time for questions. We'll invite Dr. Tom Miller to come out, Lexi Cunningham, Dr. Dunn. We'll social distance here, and we'll open it up for some questions.
Hi, Lindsay Whitehurst with Associated Press. I was curious about how you've been feeling about the support and guidance you've gotten from the federal government. I know at one point, Governor, you had hoped that President Trump might do some kind of PSA to support mask wearing. Are you disappointed that hasn't happened at all?
Certainly, this has been a long and winding path for all the states and certainly for the federal government. It is a learning as you go process. I've been appreciative of the fact that the governors have led out in many ways, which is how our system is devised to be. The United States of America, sovereign states which have their own little laboratories of democracy. They've been referred to by famously Judge Brandeis years and years ago. Laboratories of democracy, little pilot programs, all trying to find solutions to whatever the challenges of the day are. And I talked to Governor Abbott from Texas this morning to see how he's doing and the challenges they uniquely face in Texas, which are not the same as we face here in Utah. But we learn from each other. I made the suggestion to the vice president and to the president that they ought to, in fact, by example, wear the face mask. And I appreciate the fact that they are now doing that. They've learned and they are experiencing the fact that, hey, that's probably a good example. They're not necessarily saying that should be a mandate, but they are saying as a good practice, a best practice, wear the mask. And we see the vice president now and the president actually wearing a mask in public, which means we're all kind of coming to that same conclusion that it's probably a better thing to do than to not do. So we're learning as we go. The states are really the laboratories of democracy taking the lead, and Utah is no exception to that. We've acted decisively in the early days. We did not wait for the federal government to tell us what to do or how to do it, and I think that's been to our benefit. In fact, as you look at some of the statistics, you know, we are in a much better place than most other states. In spite of the surge of infections, which is too much, we still have the lowest fatality rate in the nation by far at less than 0.7%. Even one is one too many, so I don't want to discount that. But also our economy is the second best performing economy in America today, 8.5% unemployment. And as I see and sense what's taking place with our business community out there, I think you'll find that when we have numbers come out this week, or in fact, I think they come out tomorrow, Friday, I'll bet you'll find that our unemployment rate drops again in a significant amount. So on balance, we're doing pretty well. We still have a long ways to go, and we can't spike the football and say it's over. We've got to, in fact, redouble our efforts to make sure that we stop the spread of this virus. Next question.
Sorry, I had to unmute myself there. So this is Paul Nelson with KSL Radio. I've seen some articles out there that show that studies are claiming that the protests had little to no impact on the spread of the virus. And one even said that it may have actually slowed the spread down a little bit. And I'm just wondering, even if the protesters did have masks, which the vast majority did, and they were outside, it still seems like it's kind of the opposite of what we've been hearing about the spread of this virus. So, I mean, are those studies correct, or is there maybe a little bit more nuance to these studies than maybe we should know?
This is above my pay grade. I'll have Dr. Miller come first, then Dr. Dunn, if you'd like to add. Come on.
To that question, I think we know pretty well that when people are outside and with some distance, there's much less risk of contracting the virus. What we do know is that when people are cheek to cheek indoors, working in call centers, working tightly packed in restaurants, in sporting events indoors, and places like that, that is where the virus moves from person to person. Yes, it can move from person to person in an outdoor setting, but it's less likely. So I'm not surprised that the studies showed that the events, the protests are not necessarily a reason for the spikes. What I do think is, as a natural consequence of us getting back to work, which we must do, if we do that without wearing masks and without hand washing and physical distancing to the best of our abilities, the virus will continue to spread. And again, this goes back to my comment about let us not shame, let us not blame. Let's put these masks on and do the best that we can.
Thank you, Dr. Miller. Next question.
Yeah, Governor Ben Winslow with Fox 13. A couple of questions for you. What did you make of what you saw in Utah County yesterday? And given that you say that we're starting to see promising signs with these counties that have implemented local face mask mandates, why not do one statewide then if cases are in fact declining as you suggested?
Well, what I saw in Utah County, which is really what I saw on the news, we understand that people have differing points of view, and I think we need to respect different points of view and different opinions. I think we all have the same goal. We want the same outcome, which is to slow and stop the spread of this coronavirus, to protect people's health and welfare and their lives. And we also want to have the economy get back to normal. And those are sometimes a little bit of a challenging, mutually exclusive idea under the circumstances we find ourselves in. I would hope that people would show regard for those experts in the field of medicine and science, which are telling us this is what will help us, in fact, to control the virus. I hope we can do it and comply because it's the right thing to do. Show respect for our fellow man, our neighbors, love for people we know or don't know, our own families, and not have to be compelled to do it. Again, we're leaving that right now up to the local people to make those kinds of decisions, which have to answer to the people. We'll see what happens in the future. We have a goal of getting down to 500 or less as a rolling average by August the 1st. I see hopeful signs out there. I hope we'll continue. I hope we'll all start pulling together. And if we have differences, they ought to be done with respect, with a moderate tone, not an accusatory tone. Some of the things I heard said were puzzling to me. I don't believe that Bill Gates is behind this, by the way. I don't think he's spent his billions of dollars to manufacture this virus because he wants to kill off 3 billion people on the earth. But yet that's a story out there being told. So there, you can find probably a variety of things to justify your behavior. But we ought to all act like good Utahns where we care about each other. We pull together. We have a spirit of cooperation and collaboration. That's what's made us successful in the past. That's what will help us be successful going forward. So I'd call upon all of us to work together, respect difference of opinion, but do it in a manner that allows for the free speech. Again, as the Dr. Miller said, let's not shame each other and let's not blame each other. Let's see what we can do to work together, find common ground to get the right outcomes that we all desire. That's how we're going to succeed.
But Governor, do you, any response to some of the promising results in the counties with mandates and whether that justifies a statewide one?
You know, it certainly gives us food for thought. Again, I would, as I've said many times, I'd much rather do this on a voluntary basis. We get the same outcome. The question is, how do you change behavior, modify behavior, the old carrot or the stick? I would hope people would take the carrot and say, you know, I want to do this because I love my neighbor, not because I'm going to be fined if I don't show up at the office with a mask on. So again, I think there's a better way to do it, and that's voluntarily. But again, we're leaving some local control. But that is the sledgehammer we have still out there if we can't do it any other way. Let's see what we can do over the next couple of weeks, and then we'll have to make that tough decision. Next question.
Governor, it's Haley Hendricks with ABC4 News. Last week you said if students are sick, they need to stay home. But if I recall right, when I was in school, if a student missed so many days of school, they could be held back. So is there a possibility children who are sick more often than others to be held back?
I think there will be some allowances and flexibility that will be involved with this. Is a unique situation. We've never had it before. We're kind of learning as we go, trying to find a way to address the issue. Let me have Lexi come and maybe speak to that issue too.
Yes, thank you. Districts and schools are already having that discussion. What will it look like if students have an illness and need to be out of school? What sort of things can be put in place? Can they do online learning? Are there just any other ways that they can learn? But I think that it's also important to know that they're also having those discussions about staff members too. So those are discussions that are part of district plans, and they have been going on all summer. So those are going to be addressed in plans.
Thank you.
Next question.
Hi, Governor Herbert. Connor Richards with the Daily Herald. I wanted to follow up on Ben's question about what you saw in Utah County yesterday. You say that you want to respect different points of view, but what would you say to the people who were disregarding your request to voluntarily wear masks where social distancing isn't possible, who crowded in that room in Provo yesterday?
Well, I think the experts will tell us that's kind of a foolish action. You know, as we get together, and who knows who's got the COVID-19 virus, and cheek to jowl where you have an opportunity to spread it. Some did have masks there, but took them off. Again, we sometimes make mistakes. We do foolish things when we ought to be maybe more thoughtful in our actions. People get caught up in almost a mob mentality and the energy of the group. Their enthusiasm, their anger, you know, fuels the fire. There's a better way, in fact, to dialogue with the leadership. I think, you know, it was probably very true that the county commission has got really nothing to say about, you know, this issue on mask wearing in schools. That's the state health department, and the local health department has given them the right by statute, given to them by the legislature, to make those kinds of decisions regarding the health and welfare of the people of Utah. That's part of their job. That's why restaurants get closed. We've seen in the past because of not good health standards and problems that they have in the kitchen or elsewhere. That's the authority given by statute to the health department. That's the same statute that we're using today on the requirement for helping to stop or slow the spread of an epidemic or a pandemic in this case, which is in our statute. So again, I think we need to probably have better dialogue and understanding. We ought to be moderate in our tone, respectful in our speech and how we do it, and then do what Utahns do best, come together, find collaboration and cooperation. We can't solve this problem if we have a division and divisions in the ranks. We've got to find ways to pull together. And if we do that, I think we can succeed and certainly move in a more positive direction. And that's the plea I'd make to the people that showed up at the meeting last night and to all of Utah. It's not just unique to Utah County. It's throughout our state to have that same concern They may be a minority voice, but they're a loud voice. We need to work together to solve the problem. Next question.
Hi, Ross Terrell with KUER. This question's for Dr. Dunn. There was an increase, or I'll wait till you get to the podium.
Go ahead.
All right, there was an increase of about 200 cases in the Weber Morgan district. Is that related to the antigen testing, or is there something else happening there that people should be aware of?
Yeah, so we're breaking down the backlog and the antigens by health district this morning so that we can attribute them to the specific geographies. Currently, there's nothing to, like no outbreaks, ongoing outbreaks in Weber Morgan that would account for a large increase.
Got it. And then lastly, one of the places that is currently getting ravaged by COVID-19 are the long-term care facilities. Are the health mobile strike teams still active in trying to prevent these cases? And if so, what are they doing?
Yeah, absolutely. I mean, we've actually increased our ability to respond more quickly to long-term care facilities and other group settings. And so the strike teams are still active and responding very quickly to any individual case at a long-term care facility outbreak by performing testing for all staff and residents, giving them guidance on how to protect individuals from additional spread, and then doing additional testing. So going back a week after the initial case to make sure that they have caught all the spread that is there.
Okay, last question.
Hello, Governor. You mentioned that you're going to modify the orange designation for Salt Lake City so schools can reopen. Just this morning, Mayor Mendenhall said that it is time again for a statewide mask mandate. The question is, do you have the support of the mayor and the school district to change or modify the orange status? And if you don't believe that you have it, will you do it anyway?
Well, let me say I have a good working relationship with Mayor Mendenhall. We've talked about the need to get Salt Lake City, the capital city of Utah, to move from orange to yellow. We aren't quite there yet, but we certainly have that as a goal. And I think that's good for a lot of reasons. It would show that we've got some kind of control over the spread of the virus. And the business community would certainly applaud that because it'll make it easier for them, in fact, to be successful as business entrepreneurs and commerce to in fact, unfold in Salt Lake City, which is being hampered by the fact that they're in orange right now. The school board has got to make the decisions with Salt Lake City. We're just allowing them to make sure that they are not disenfranchised, that they're not somehow hindered from opening up because they happen to be in orange. So this is done as an accommodation. There already is a requirement for them to have masks on in Salt Lake County. So that gives them a little bit of a leg up, although we've added to our own mandate as far as students to wear masks, as well as teachers and principals and visitors and staff members and et cetera. So that kind of ends up being the same thing. But this allows the school board members in Salt Lake City School District to in fact say, we're going to open up similarly, if not exactly the same as other school districts. As you heard Lexi say, they're not all the same. They have different plans, different accommodations, the population sizes. Some have more minorities, which takes some extra effort to make sure that they're practicing good protocols at home, et cetera, where we have maybe multi-generational families living together. Anyway, there's all uniqueness out there, but this is designed to let Salt Lake City School District open up. We have a number of people, not just Mayor Mendenhall, that call for a statewide mandate for masks. That's nothing new. That certainly is on the table as a potential, but as of right now, that's the lever we're not going to pull. I like what we have on the right now with the local control. The local communities can make their decision. I've never been a one-size-fits-all kind of a guy. We have some of our rural counties which are in green. And there'd be no reason for that to be a challenge for them to have everybody wear masks. So we're trying to find the right balance using common sense approach, which makes sense if us all working together, we can all support. And yes, it is somewhat of a compromise on all those issues, but by golly, that will help us pull together, which is what we need to have more than anything else. With that, we'll cut off the calls right now and the questions. We thank you all for your attendance. Again, I am optimistic about our future. 37 states have had surges and increases in the coronavirus, so we're not alone in that challenge. None of them are doing as well as we are when it comes to the mortality rates and the economic opportunities. So we have been threading the needle pretty good. That being said, we've got to redouble our efforts, all of us as people of Utah, to do our part. We can't say it's somebody else's responsibility and neglect the fact that I have a responsibility to do my part. We know it's simple. It may be inconvenient. It may be a sacrifice. But compared to what the greatest generation had to sacrifice during World War II, to fight the enemy then, where the men had to go off to war, we had to have the women do the manufacturing in the factories. Was it Rosie the Riveter, out there doing the work? Rationing of food, rationing of gasoline, growing our own victory gardens to make sure we had enough food. The sacrifice they put through, and they look back now on this generation, and I heard one lady say, "You're asking me to put on a mask? That's sacrifice. That's way too much for me to do." We need to put it in perspective. We're not asking too much for us all to do what is necessary to sacrifice to get on top of this war with the coronavirus. Let's do it together. Thank you.